We're back with our Medicare and Affordable Care Act experts. And so, Laura, I wanted to toss it out to you first, and let's talk about some of the changes that we're seeing this year because of the inflation bill.
Well, the Inflation Reduction Act, which just got signed into law a few weeks ago, has all kinds of good changes for your health care. For the Affordable Care Act, it means that the premium costs are going to continue to be capped at 8.5% of your income. So that's good news for another 3 years. Those ACA plans will continue to be affordable. Also coming soon for seniors on Medicare, your out-of-pocket drug costs are going to be capped at $2,000 a year. And starting next year, some basics are going to be included in your Medicare, such as the new shingles vaccine. You'll be able to get that, as well as they're going to smooth out your costs throughout the year so that you don't face a big drug bill in January, but it's throughout the year. So there's all kinds of pieces in the Inflation Reduction Act that will affect your care. That's why I am here on the Protect Our Care bus tour talking about it, and we'll be in Greensboro on Monday.
All right, gotcha. All right. So this is another Medicare question. It says, my son's going to be 65 in 2 weeks. He tried to sign up on Friday, and they told him if he was working and had insurance, he couldn't sign up for Medicare. So, Catherine, what should he do?
Well, he still has to sign up for Part A. And then if he's in a deemed plan, he can waive or not sign up for Part B, but he definitely must do that. So send him to Medicare.gov to look at that, or have him go work with an insurance agent to get him signed up. But that is not accurate, and he could end up paying penalties later that could be avoided. And they will be for life.
Yeah, all right. On top of that, this is another question. My wife is turning 65, but she's covered by my insurance. We know she needs to sign up for Part A, but we would rather delay signing up for Part B. Eventually, she'll sign up for Part B. Our concern is that 10% penalty. So, Steve, what exactly do they need to do?
First of all, they probably need to talk with their human resource people through that group plan. Make sure that that group plan is a credible coverage and meets that definition under federal guidelines. Then, if that's the case, she can stay on that group plan and she can delay or defer the Part B until later on when she needs it. And then when she does need it, you sign up within 30 to 60 days of losing that group coverage. And if you follow all that and all those guidelines and all that's all good and well, there is no Part B penalty. So she's in good shape.
I just want to clarify. So like when you sign up, she's going to check the box for Part A. And for Part B, it either says deferred or take it, right?
Right.
Okay, and so she needs to hit deferred. So you can't leave the boxes empty, I guess is what I'm saying.
Right, correct.
Okay.
Yeah, she needs to make that election and make that clear. Yeah.
Okay. All right. So just very quickly, let's go through the dates so that everyone knows. Catherine, when is the cutoff date for Medicare enrollment for this open enrollment period?
December the 7th.
Okay. And then, of course, 65, you got that 7 months. And Laura, again, let us know what those dates are so we don't miss it.
Well, you start signing up November 1st, which is real soon, and then you have through January 15th.
Okay, so you got a good amount of time there. That may mean that you can go on healthcare.gov right now and look at those things so that it doesn't become a last-minute decision. Thank you all for your time and your expertise. We so appreciate it. And again, you're going to be in Greensboro on Monday at 3 o'clock to talk about that. So if you have questions, that's another place for you to go as well. If you missed any of this information, we're going to put it all on our website for you. It's in the Who Wants to Know section.